Relieve outer elbow pain now. Mills stretch and ECRB muscle mobilization. What the heck is that? There's the little muscle that starts on the lateral epicondyle and some of the ligaments on the outer elbow. It comes down across the forearm and connects to the back of the wrist in the second dorsal wrist compartment. In fact, it's truly the most uncommon tendon in true tennis elbow or true epicondylalgia. However, today's video is more about treating the muscle, which can also cause outer elbow pain. It can even cause dorsal wrist pain. So first is to find this muscle. How do you find it? Find the bony prominence on the side of your elbow and come down just a little bit. Pull your wrist up and in and feel the muscle contract under your thumb or fingers. If you're not sure, you can extend the fingers to feel the muscle next to it and then go up and in to find it. Okay, now I'm on ECRB. It's right next to its big brother, ECRL, which can also cause outer elbow pain. So you might as well treat both. Next, I'm going to mobilize this muscle with the self-care mobility ball. We prefer the small Supernova by Rogue. If they're ever interested in sponsoring the channel, we would gladly help you do that. So here we're finding ECRB by pulling the wrist up and in and then relaxing. I'm starting with rolling of the muscle and soft tissue over it. Next, we're tacking and twisting to glide and slide the deep layers of the skin and fascia over it. Break up any adhesions or restrictions. Lastly, I'm pushing the muscle into the bone, tacking and twisting, and going with fiber and cross fiber. I can hold for trigger point release 10 to 20 seconds, or I can mobilize muscle for 2 to 5 minutes, or the least dose, least time to find less pain and tenderness. A more advanced technique is contract relax. So pulling the wrist up and in, tacking and twisting and shearing, and then stretching it down and away into what's known as Mills stretch. Dr. Mills was the first one to identify this stretch, and we're still giving credence to his name this day. After we mobilize in the Mills stretch position, we shall do Mills stretch. Make a fist, straighten your elbow, rotate your palm and forearm away. Flex or bend the wrist, keep the elbows straight, so I'm doing a little distraction on my distal or end of my forearm bones, the radius and ulna, and then I'm pushing the wrist up towards the ceiling into what's known as radial deviation. I'm holding for 5 to 10 breaths, repeating 2 to 3 times. Now remember, appropriate ergonomics, lifting technique, sport technique, how you use your elbow, wrist, and hand can often matter more than just treating the symptoms from it. So identify your throwing mechanics, your work mechanics, your work ergonomics to see if we can prevent this from ever even happening. If you do end up with it, or you find that you use your forearms and elbows and wrists and hands a lot, particularly with palm down, gripping and extending up and in movements, we can off balance this by lifting with palm up. Also, instead of grabbing things with palm down, we can grab things in a neutral position, or we can grab things with palm up. This is often needed for several months to offload the tendon, if involved, to get long-term pain relief. For muscle health and elbow health, we can do our muscle mobilizations, our contract relax, and our Mills stretch. Here we are, round 2, a minimum of 30 seconds to 1 minute, or 5 to 10 breaths. I'm working on extending the elbow to keep full elbow extension. An early on arthritic sign will be loss of elbow extension. See some of our future videos to help teach you how to restore this range of motion to prevent elbow pain and degeneration. This is Dr. J with the Human Movement Institute, where we have improvement through movement.